Hi, I'm Tom Morrison and welcome to my Hack Guide to Health Funds. In Australia, we are lucky enough to have an amazing healthcare system in the form of Medicare, but potentially insuring your family can help to take care of some of its shortcomings in the form of either hospital cover and/or extras cover. Now, insuring your family can be an expensive business, but there are steps that you can take to make sure that insuring them is not a waste of your money. So have a look at the 5 tips below, and this may help to guide you in your choices of how to insure your family and who to insure them with, or potentially give them the boot altogether. Number 1, hospital cover. Do you need it? Well, hospital cover as a rule is one of the less predictable ways for you to make the most out of your health fund and get your money back. Emergency surgeries, extensive and complicated medical procedures should not really be your main motivation, as you'll often end up in the public system anyway. Where they do come in as a bit more benefit is elective procedures. You'll have shorter waiting times, and you'll also have the freedom to be able to choose the doctors that you want to go to. Another factor is the Medicare levy surcharge. If you're earning over $90,000 a year, then you may well pay the equivalent of your health fund premiums in a surcharge to the government, so you may as well have it. Finally, if you view yourself as needing health fund cover at some point in the future, you might as well have it by the age of 31. Beyond that age, the government will start loading the premiums that you have to pay, and they will increase exponentially after the age of 31 for every year of cover that you do not have. Number 2, extras cover. Now, it's a little bit easier with extras cover to work out the benefit to you and potentially your family over the course of a year, as its use is generally a little bit more predictable. Extras cover will include things like physio, optical, dental. So generally, we're going to be a lot more aware of ways in which we can use this. One thing to remember is that if you are taking out health fund insurance for purely tax purposes, extras cover will not make any difference whatsoever. The other thing to take into account is the age of you and your family. Benefits for families with kids aged 0 to 5 will on average pay out $100 per year, as opposed to families with kids aged 10 to 14, it's normally closer to about $400 a year. This may be due to the higher likelihood of expensive treatments like braces, but certainly the age of your family will be an important factor. Much the same, one of the highest claiming age groups is 55 to 79-year-olds, who will normally use up to $600 a year's worth of extras. It makes a huge difference which fund you are with though, so be sure to shop around, as some health funds are definitely more generous than others. Number 3, when doing your research, the devil is in the detail. So you've got to know the terms and the figures to look at when trying to compare one fund to another. Now, I won't bore you all with them here. They are things such as lifetime health cover, Medicare levy surcharge, just private health fund rebates and how they work, the percentages and the figures and how your earnings are maybe affected by them are all really important factors to take into account. If you want to read through those in more detail, then head over to our ebook on our website and you can get a bit more information there. When looking at your health fund and either starting a new or switching, a really important factor is going to be waiting periods, especially if you're looking for it for a specific condition that is occurring then and there. There is certainly generally a waiting period for extras that can be anything from 2 months for general dental, up to 12 months for major dental, up to 36 months for hearing aids. So have a chat with your fund before, discuss your needs with them and see if they're going to fall short if you need them in the immediate future. Hospital cover generally is going to be up to 12 months for any pre-existing condition. There's a lot of variance between them, so it's just about having the chat. Generally, health funds are really keen for new customers, so they will sometimes be inclined to waive waiting periods. But it's important to just have that discussion up front and not just hope for the best. And finally, what do you need to know about your extras covers, especially pertaining to dentistry? Now, dentistry is probably one of the most predictable way for you to get a consistent amount of money back from your health fund. Even in perfect health, all of us should be going to the dentist twice a year. Now, some health funds will even offer up to 100% rebate for routine dental appointments. This can be up to $500 per person, per family member each year. So it's a significant rebate. What are the different factors in extras cover with dentistry? Number one is just the type of cover, and that's important to be aware of because it will depend on your needs. There's general dental. This is fillings, x-rays, extractions, and major dental, crowns, root canal treatments, implants. So knowing the difference between those two, knowing what you're most likely to need is going to be an important factor in your decision making. Number two is, do you want the freedom to go to the dentist of your choice? Because you do need to be careful of some of the larger health funds that will penalize you for choosing a dentist that is not specifically affiliated with them. So be wary of some of those ones. Another factor to be wary of is the health funds that have a joint cover for the entire family. This can be a real problem when one family member has a lot of issues in the first half of the year. They can essentially use up an entire family's worth of rebates and put other family members in the firing line for greater out-of-pocket costs later on in the year. Finally, and a really important factor in planning proactive dental treatment is, when does your health fund refresh? The majority of them are calendar years, but some of them are financial year. And if you are going to be doing proactive treatment to deal with problems before they sort of happen at inopportune moments, then you're really better off getting onto those in the last few months before your health fund refreshes, rather than doing it right at the start of your health fund year and putting yourself once more in the firing line for greater out-of-pockets when those unexpected events may happen. So those are some very basic tips on a pretty boring topic, to be honest, on how to get the most of your health fund. There is much more detail, much more information in our ebook though, so you can find that at our website. If you want some other information on dentistry, then head over to our YouTube channel as well, and we look forward to seeing you soon.